New technologies assisting birth control to date. Birth control is the use of devices or practices to prevent a sperm and egg from uniting, therefore preventing conception of a zygote. Using some form of contraception is very common in our society today for both men and women. The most effective method is abstinence, followed by surgical procedures and then hormone-affecting medication. The least effective devices are used on the body in manual methods. Only condoms prevent against pregnancy and sexually transmitted diseases. 85 out of 100 sexually active women who don't use birth control will become pregnant within a year. Here's a chart showing current birth control methods and their effectiveness. While it's not necessary to go through each one, you can notice some similarities about the number of pregnancies per 100 women per year. Permanent methods such as the vasectomy, tubal ligation, and the IUD all have less than one pregnancy per year. Taking the daily pill and using condoms is a little less effective, with about 10 or 15. And manual methods such as withdrawal, cervical cap, and fertility tracking are even less effective, with about 20 pregnancies. Abstinence, of course, is the most effective. The Harris County Public Health Department offers a variety of low-cost clinical and preventative services to meet people's needs locally. There are 4 clinics that provide the following family planning methods: male and female condoms, contraceptive pills, Depo-Provera injections, vaginal hormonal rings, IUDs, contraceptive implants, spermicidal foam or jelly, and pregnancy testing. The 4 locations are Antoine, Humble, Baytown, and the Southeast. In Texas, the Texas Health and Human Services offers many healthcare programs. The Family Planning Program is part of a new initiative called Healthy Texas Women, offered to both men and women with services such as general family planning, STD and HIV testing, and a variety of birth control options detailed below. According to the graph in THHS data, short-acting hormonal contraceptives, long-acting reversible contraceptives, and permanent sterilization are all 99% effective. Barrier methods are 94 to 98% effective, and natural family planning methods are highly ineffective. Abstinence, of course, is 100% effective. At the national level, birth control and family planning services are controlled by the Center for Disease Control and Prevention and the Office of Population Affairs of the U.S. Department of Health and Human Services. These entities provide the guidelines for state, local, private, and public health centers to follow. The U.S. faces many reproductive health challenges today which affect minorities disproportionately. Those challenges include 50% of all pregnancies being unintended, 700,000 girls aged 15 to 19 become pregnant annually, with 300,000 giving birth. 1 in 8 babies are born prematurely, and the U.S. infant mortality and adolescent pregnancy rates are much higher than other developed countries. The CDC and OPA believe family planning services can solve these challenges by providing education, counseling, and medical services. Their philosophy is reproductive health can be improved by defining a set of family planning services for men and women, explaining these services while providing contraceptives to adults and teens, and encouraging preventative health services for all.
In this section, we will look at the impact of birth control rates in relation to race, ethnicity, age, and education. According to the National Survey of Family Growth, the majority of women in the United States are currently on some form of birth control. In 2011 to 2013, birth control was used by approximately 62% of women ages 15 to 44. The most common forms of birth control were the pill, female sterilization, male condoms, and long-acting reversible contraceptives. Long-acting reversible contraceptives use was higher among women ages 25 to 34. Current condom use was similar across the 3 Hispanic origin and race groups at about 9%. The current use of female sterilization declined, and the use of the pill increased with greater education attainment. As you can see here, we have the top 4 contraceptives used by Hispanic origin and race and by age. So the first graph on the left shows the contraceptive use by Hispanic origin and race. As you can see, female sterilization was more common among Hispanic and non-Hispanic black women as opposed to non-Hispanic white women. The pill was the main choice for non-Hispanic white women. Condom use was about the same across the board as stated earlier, around 9%. And long-acting reversible contraceptives were used primarily by Hispanic and non-Hispanic white women. In the graph on the right, we see the top 4 contraceptive choices by age. We can see that female sterilization is more common among women ages 35 to 44, whereas the pill is chosen among women ages 15 to 24. Condom use is used more predominantly among younger women ages 15 to 34, and long-acting reversible contraceptives are more common among women ages 25 to 34. This last graph shows the top 4 contraceptive choices based on education level. According to the graphs provided by the NCHS data brief, less permanent forms of birth control were chosen as education levels and subsequently income levels increased. Looking at the graph, we can see that female sterilization was most common among women with no high school diploma. The pill was most common among women with bachelor's degree or higher. Condom use was most common among people with no high school diploma or those with a bachelor's degree or higher. Long-acting reversible contraceptives were pretty even across the board. However, women with some college but no bachelor's degree tended to use this form of contraceptive more. Older women and non-Hispanic white women were more likely to use any contraception compared to younger women and women of Hispanic and non-Hispanic Black origin. The use of contraceptions impacts fertility and birth rate. According to NBSS 2015 data, birth rates by age, race, and Hispanic origin have declined from 1991 to 2015. In conclusion, various forms of contraception offer different levels of effectiveness. Many locations in Harris County offer contraception options for both men and women. Contraceptive use varies by race, ethnicity, age, and education level. Birth control use by social and demographic characteristics offer insights into fertility patterns and birth rates.